If you want to look good and feel great, start with your heart. In fact, heart disease ranks as the #1 killer of men and women. If that's not enough to get your attention, maybe this is. By spending just a few minutes at a new screening center here in the Mid-South, you could find out if your heart health is at risk and what you need to do about it.
Breathe in. Hold your breath.
This big machine looks intimidating, but the only danger is in what it could see. It's just taking a few snapshots to get a better picture of what's going on inside you. And it's one of several screenings used at a new center to assist in the early detection and prevention of heart disease.
What we're looking for is people who don't have symptoms but who might have serious narrowing of the arteries that could then go on to produce stroke or heart attack.
Patients like Bill Satcher. Although in Bill's mind, a health screening was not a top priority.
I'd been working, we'd been traveling some, I'd been just leading a normal life.
Bill's family, on the other hand, is of the opinion that an ounce of prevention is worth a pound of cure. After a little persuasion, Bill went in for the screening. First up, some ultrasound testing.
We offer a package of 3 vascular ultrasound examinations. The first is an examination of the carotid arteries, which are the 2 large arteries that are the primary blood supply to the brain. The other 2 exams are an examination of the abdominal aorta and what we call an ankle brachial index, where we measure the difference between the blood pressure in the arm and the blood pressure at the ankle.
To Bill's surprise, the results were not great. But the next test sent a real wake-up call. It's called HeartScore, and it detects the buildup of plaque in your arteries, which can block the flow of blood to your heart. On this test, you want the lowest score possible. 0 indicates the lowest risk of a future problem. Anything above 400 shows the highest risk. Bill's score? 519.
That level of coronary artery calcium is a pretty strong indication that there are some significant blockages in the coronary arteries.
Here's what the HeartScore results look like. In Bill's case, you can see the calcium buildup in the arteries, which required the placement of 2 stents in one artery and cleaning out some others.
My blood supply is better now than it was before. It says you can do anything you feel like doing.
Anyone can take the tests, but they are recommended especially for people who are 40 and older, as well as those with risk factors such as smoking, diabetes, hypertension, or a family history of heart disease or stroke. For Bill, spending just a few minutes at the center changed his life.
I could have had a heart attack, is what it amounted to. He told me that I had just prevented a heart attack by having it done.
And heart disease is not the only problem the center targets. For example, a bone density test can detect the likelihood of osteoporosis, a disease that can significantly lower quality of life and may lead to more serious conditions.
The technology is available and it's proven. It's fairly simple, it's non-invasive and easy to do. It's simply a matter of getting people who have significant risk factors to come in and let us take a look and see if they might have a serious problem.
Bill may have scored high on HeartScore, but he's also scoring points with his family by taking their advice and taking care of himself.
I consider it very important because I hope to be around. We have young grandchildren, and I hope to be around to watch them grow up.